Hello everyone, nice to see you again. I hope you are doing well during this CCP virus pandemic. In our last 3 episodes, we discussed how during December and January, the cover-ups on top of cover-ups prevented people from knowing that a terrible infectious epidemic was spreading rapidly. What's more unforgivable is the Chinese Communist Party, the CCP, deliberately destroyed and suppressed the testing results of the virus. Why did they do so? The world needs to ask. Now, let's continue to talk about what happened before and after the dramatic lockdown of Wuhan. On January 22nd, patients continued to flock to hospitals in Wuhan. Dr. Ai Fen of Wuhan Central Hospital said to someone that their emergency department had seen 1,523 patients on the previous day, and that was 3 times more than usual. Among those, 655 patients were having a fever. Social media posts as well as some official media reports show that hospitals were overwhelmed by crowds. People had to line up from 3 a.m. in the morning to try to see a doctor. Some hospitals had no more capacity at all and turned down patients. Panicked patients and their families running from one hospital to another to seek treatment without proper protection. This made it easier for them to either get infected or spread the virus all over the place. People packed together in very close distance as they didn't know how serious or how fatal this virus could be. Also on this day, Wuhan Health Commission required every community clinic center to send at least 2 doctors and 1 nurse to the designated hospitals to support. According to a doctor and a community clinic center, these centers weren't able to play any roles at the early stage of the outbreak. They only got involved after the city was locked down. And for the first week, their main task was to disinfect the homes of the dead and to move out the bodies. Sometimes they even needed to make several trips in one night to move the bodies. At that stage, if we check the numbers, the CCP was only reporting a few or less than 30 new deaths in the entire country. It was hard to imagine when there were only less than 30 new deaths in the whole country. One community clinic center in Wuhan needed to make several trips in one night to move the bodies. This doctor also said that their supervisors didn't require them to adopt level 2 prevention and control measures. Instead, they were only adopting level 1 measures, which was the lowest level, only requiring to put on single-use hands, shoes, gloves, and surgical masks. After the lockdown, the director of the community clinic center went to the city's health commission every day to attend meetings, but they were not allowed to send out any information on the internet, even within their own work group. All internal documents and data were printed on paper. No electronic versions were available. From these facts, one can see clearly how strictly the CCP has been controlling the true situation from being leaked through the doctors. Also on this day, Wang Guangfa, a member of the expert team sent to Wuhan to inspect, who had said that the disease was preventable and controllable and who had contracted the CCP virus later, posted an update on his Weibo account saying that his situation had been improved and that the disease was indeed preventable and controllable. Also on that day, around 300,000 people escaped this city while railway system alone. Also on this day, North Korea became the first country in the entire world that closed its border to China. People say this is because, as a fellow communist regime, North Korea knew better about the CCP's nature and that it was lying, so North Korea chose an outright closure of its borders. Also on this day, both Hong Kong and Macau confirmed their first CCP virus case. And WHO Director General Trudeau's and Hanlon continued to praise CCP's handling of the outbreak, saying, quote, I was very impressed by the detail and depth of China's presentation. I also appreciate the cooperation of China's Minister of Health, who I have spoken with directly during the last few days and weeks. His leadership and the intervention of President Xi and Premier Li have been invaluable, and all the measures they have taken to respond to the outbreak, unquote. Then let's move on January 23rd. On that day, at around 2:30 a.m., Wuhan suddenly issued a lockdown notification stipulating that starting from 10 a.m. on the day, the city's bus, subway, ferry, and long-distance passenger transport will be suspended. Without special reasons, citizens should not leave Wuhan. The departure channels of the airport and the railway station are temporarily closed. Resumption time will be announced separately. From then on, the city would be put on lockdown for 76 days. On the same day, multiple cities in Hubei also announced lockdown. Many other provinces and cities initiated Level 1 emergency response. Beijing and other cities announced close down of sightseeing places. During the 8-hour window from Wuhan's announcement of lockdown to the actual lockdown, a large number of panicked people rushed to escape the city. Hundreds of thousands managed to leave through all channels. Later, the mayor of Wuhan himself admitted that 5 million people had left Wuhan before the lockdown, whilst a study of researchers at the University of Southampton estimated that as many as 60,000 residents had traveled out of Wuhan and went around the world since the outbreak started, but before the travel lockdown was put in place. Also on this day, just as the Red Cross Hospital in Wuhan was designated for the CCP virus treatment, over 2,000 patients flocked to it as soon as it opened. The hospital usually had only a capacity to handle a few hundred patients. It had to set up tents outside the hospital to deal with the situation. Some patients collapsed while waiting in the lines. In the meantime, a local newspaper, Chutian Metropolitan Daily, reported that an emergency 1,000-bed hospital would be built in 6 days. Also on that day, while the confirmed cases in Zhejiang province rose to 10, all medical workers at Wenzhou Medical University were required to sign a confidentiality agreement. Obviously, doctors were not allowed to reveal the situation of the epidemic. Notably, on this day, China's National Health Commission issued the biosafety guidelines for laboratories regarding novel coronavirus. There were many items in the guidelines, including biosafety requirements for the virus culture, animal infection experiment, handling of uncultured infectious materials, transportation and management of pathogens and samples, waste management, etc., and how to handle mistakes and mishandling of laboratory biosafety issues. You know, in China, one of the unspoken rules to interpret the government's moves or guidelines is when they say we must strengthen something or pay attention to the safety of something, there must be something already going wrong in this area. problems must have already occurred. So, on the day of the lockdown of Wuhan, the National Health Commission's sudden move of issuing such safety guidelines makes people wonder, does this mean something already went wrong with their labs? What did they know that we don't know? Also on that day, when people in Wuhan were either escaping in panic or staying in fear when a dramatic lockdown was suddenly imposed, CCP's leader Xi Jinping and some 2,000 other leaders and elites were having a grand, happy Chinese New Year celebration at the Great Hall of the People in Beijing. Xi Jinping made a speech of more than 1,500 words without mentioning even one word about the epidemic or the suffering of the people in Wuhan, nor did he give out any warning to the nation about what was happening with the epidemic. The leaders and participants were also entertained with singings and dancing performances to sing the praises of the CCP. And the evening news of China Central TV reported about how the WHO was praising China for its epidemic control measures. Also on this day, WHO stepped back from declaring a public health emergency of international concern, saying its expert committee would meet again on the next day to discuss more evidence from its teams on the ground. On January 24th was the eve of Chinese New Year, but for the frontline medical workers, it was feeling like hell. Some doctors broke down as they couldn't handle the pressure.
你说你们呢？我不想回家，我不想回家过年啊！你们做了什么？你们做了什么？你们5个只是看了800个病，还他妈1天4个班，他把我们抽了8个班进去上班，我们不想活。你自己看，你们到底想干什么？你们啊！我不要人，你把那些病人都搞走，躺在地上那个拿走。同志们，你不跟院长说不要干了，因为搞得就不方便了，算了，叫我滚蛋，回家。不然跟我这样说。我没有闹。这病躺那么多怎么办？
叫他们院长过来看看。
院长谁过来？
你说让病人去跟。
没有，我去了。
把走到台了。
啊？我不知道哪个是院长，我去了，我连1、2、3、4、5、4打热线都打了。
Some complained on social media that they didn't have proper supplies or equipment. Videos of people suddenly collapsing while waiting at the hospital, as well as bodies lying on the ground inside the hospital for an entire morning without being taken care of, were circulated on social media and then got deleted inside China. CCP's Youth League's Weibo account published a statement on the next day saying the video of bodies lying in the hospital was faked, and they claimed that bodies lying in the hospital was made up and not true. However, interviews with doctors later confirmed that there were indeed bodies lying in the hospitals, and that handling the bodies had become a major challenge for doctors and nurses, and they all needed to be properly disinfected before they could be moved out. Sometimes several patients in the ICU died on the same day. Sometimes the bodies were only moved away on the next day as the funeral home workers wouldn't come soon enough. Dr. Wang Xiaobo from the People's Hospital in Sichuan province, who went to Wuhan to support, also revealed later that at the Red Cross Hospital, they had to wait for several hours or even more than 10 hours for the bodies to be moved out of the hospital. Also on this day, Mr. Chen Qiushi, a lawyer and a citizen journalist, arrived in Wuhan and started reporting from the ground of the situations in Wuhan. Also on this day, Vietnam reported person-to-person transmission, and Japan, South Korea, and the US reported their second cases. The second case for the US was in Chicago. Within 2 days, new cases were reported in Los Angeles, Orange County, and Arizona. The virus was now in several locations in the United States, and the odds of preventing an outbreak were dwindling to 0. Then let's move on January 25th. Chen Qiushi reported from Wuhan that at number 11th hospital in Wuhan, hundreds of patients were still lining up in the corridor at 11 p.m. in the night, and there weren't enough resources, including medical staff and supplies. Other videos also showed overcrowded hospitals. Also on that day, the WeChat Security Center released the announcement on special management of rumors related to novel coronavirus pneumonia. It stipulates that any person who fabricated false information about dangerous situations, epidemics, disasters, or police situations, disseminates them on information networks or other media, or knowingly disseminates them on information networks or other media, and seriously disrupts social order, shall be sentenced to imprisonment, detention, or house arrest for a term not exceeding 3 years. If serious consequences are caused, he or she shall be sentenced to imprisonment from a term between 3 to 7 years. Under these rules, people who tried to spread the true situation can easily be targeted as spreading rumor. After the outbreak of the CCP virus, since the official media wouldn't report the truth, people could only rely on individuals to pass on information. However, the tight control of the internet made it very difficult for people to spread the truth. On January 26, hospitals in Wuhan continued to be overwhelmed. At the Red Cross Hospital, over 1,000 people, including 400 medical workers, squeezed in the already infected space, while the hospital only had the capacity to do 10 virus tests on that day. At the Central Hospital of Wuhan, the hospital canteen ran out of food, as usually it only cooked for 2,000 people twice a day, but on that day it needed to prepare food for 6,000 people 3 times, as all patients and medical workers need to stay at the hospital. Some departments ran out of food for 3 days. Also on that day, the US announced it would close its consulate in Wuhan and ordered employees to evacuate. Hong Kong also announced that it would close its border to non-residents who had been to Hubei province in the last 14 days. At this point, we can see that the virus had already spread widely before the lockdown, and situations became dramatically worse in just a few days. Okay, let's take a break here and continue our discussion next time. Thank you for watching. Truth saves lives. Please do subscribe to my channel and share it. Thank you again. See you next time.